Yes, we can hear you clearly, Doctor.
Okay. So, hello to everybody. I'm very glad being here with you today, and thank you for joining us for today. My name is AmirReza Bahador, and as you know, I've got admission from Boston Dental University for this cycle, 2022. So today, our plan is just talking about the ADAT exam and how it goes. I will try to give you some useful information about the exam, how you can apply, what are the contents of the exam, and after that, after my presentation finalized, you can ask your questions. So I will tell you that I've managed another session. I think that would be next week, the same day and the same time. And on the next session, we will talk about how to apply for US dental schools. And today we are just talking about the ADAT exam. So let's get started. But before that, I want to ask you just keep your audios mute and don't ask me any question. Please let me just go straight forward till the end. And at the end, I will be there for you to answer all your questions. Thank you. So let's share my screen with you. There we go. So, as I told you, today we are talking about ADAT exam. ADAT stands for Advanced Dental Admission Test. And what is ADAT exam used for? Basically, ADAT exam is just an exam that dental students in the United States and even Canada take it at their third or fourth years of their education to seek for some specific specialty programs like oral surgery, orthodontics, and the specialty programs like periodontics or prosthodontics doesn't require this exam. So I gotta tell you that this is a very specific exam, which all dental students, which are just seeking to go for some specific specialty programs in the United States, go for this exam. This exam is really extended, and there are lots of topics about this exam, and I will try to give you a view of this exam in the upcoming slides. First of all, we will talk about ADAT content. As you can see here, ADAT is composed of 200 questions, and these 200 questions are divided in 3 categories. And you can see the first category is about biomedical science, which consists of 80 items or questions. The second part would be about the clinical science with 80 questions, and the last part would be about data research interpretation and evidence-based dentistry, which consists of just 40 items. And I want to tell you that this part of exam is really important because the first 2 items of the exams is just about dentistry. So all the dental students or dentists somehow know about that. But this part of exam, consider that this exam is just for seeking for specialty programs. So they want you know more about these topics. So I call this part a game changer in this exam. And if you be prepared enough for this part of exam, so it can boost your score in this exam. So I will talk about this part in the next slides. As I told you, The first AD questions of exam is about biomedical science. As you can see, in biomedical science, we have 4 categories again, which is anatomic science, biochemistry and physiology, microbiology and pathology, and dental anatomy and occlusion. Each item has 20 questions, which is covered in this part. For anatomic science, you can see it says gross anatomy. I want to tell you that this is a kind of exam that dental students are taking for specialty programs, which means it's not about the whole body. Their main focus would be on head and neck. Then would be histology, oral histology, and developmental biology, which is embryology. And again, this part is just about head and neck and the tooth development. The second part is about biochemistry and physiology. And you can see there are lots of topics right here. It consists of biological compounds, which contains carbohydrates, proteins, amino acids, vitamins, minerals, etc. Metabolism, molecular and cellular biology, connective tissue, membranes, nervous system, muscle circulation, respiration, renal, oral physiology, digestion, and endocrines. And you can see they've covered all the parts of the body about the regard to physiology. So it would be a little tricky to cover everything and don't overdo it. So I will talk about that later. The third part is about microbiology and pathology. And you can see it consists of general microbiology, which consists of bacteria, virus, a little bit of fungi and parasites, reaction of tissue to injury, immunology and immunopathology, microbiology, immunology and pathology of specific infectious disease, systemic pathology, and gross disturbances like syndromes or neoplasm, etc. The last part is about dental anatomy and occlusion, which I love it. And we as a dentist, we should get the whole score in this part because it's about our job. It's about tooth morphology, pulp cavity morphology, calcification and eruption, and principles of occlusion and function, and tooth morphology abnormalities. This was a whole schematic form that shows you the topics that you have to cover all to get the 80 items or questions in biomedical science. Let's move to another part of exam, which is again consists of 80 questions, clinical science. As you can see here, it covers all the topics in dentistry: endodontics, operative dentistry, oral and maxillofacial surgery and pain control, oral diagnosis, orthodontics, pediatric, periodontics, pharmacology, prosthodontics, principle of ethics, and patient management. So you should know about all of these topics. So I want to tell you that there are different type of questions in this part of the exam. Some of them are standalone, and some of them are case-based scenarios. For case-based scenarios, you will have some questions, which is a case which is presented, and after that you have one question. And there are some cases that you have a case, a patient, they demonstrate all the information about that patient, and you will have 3, 4, or 5 questions about that specific patient. So now we are moving to the last part of the exam, the game changer: data research, interpretation, and evidence-based dentistry, which is 40 items. It's about study design, data analysis, result interpretation, inference, and implication. Here I've added a part of ADAT guide, which is published by ADA website for this part, for the evidence-based dentistry and research part, you can see they try to just inform us about what contents would be in this part. It says that you should have ability for asking precise, structured clinical questions, finding the best evidence using currently available electronic resources, reading and critically evaluating research information, understanding clinical trial design, understanding and interpreting basic statistical information, using an evidence-based clinical guidelines, and implementing best evidence in clinical practice. This part is a little bit tricky because there is not a very definite resource or source for study on this part. I remember that in my own exam, I had so much difficulty for this part. But as I will tell you at the end of the session, we are trying to figure out how we can help you just get through this part. As I told you before, about the clinical science part, there are some case-based scenarios, and here is a chart that you will see in your exam. I put this picture here to show you that the numbering system in the US for the tooth is just like this, from 1 to 32, and they do not use the 2-digit numbering of tooth. So it's really important to be familiar with this type of numbering of the tooth. At first, it may be somehow hard for you, but by practicing, you will be comfortable with that. I want to just let you know that in the United States dental exams, it would be like this. And again, for the case-based scenarios and questions in clinical part of the exam, you will have some chart for patients, patient information, chief complaint, background, and patient story, and current finding. And as I told you before, there are two types of these questions. Some of them has just one question about the case, and some of them has 3, 4, or 5 questions about the case. Here is the time frame for the exam. You can see the whole time of the exam is 4 hours and 30 minutes. There is a 15 minutes tutorial at first. Because it's an online exam, you have to go to Prometric centers. So there is a tutorial to help you how to navigate your exam. And then you will start with biomedical science, 80 items with 95 minutes, which is enough, I think. Then you will have 10 minutes break, which is optional. You can skip it. It's up to you. You can go for the second part, clinical science, with 80 questions. You will have 90 minutes. And I want to tell you by my experience, 90 minutes for these 80 questions is a little tricky. And I remember that I had a hard time in this part. You should manage your time in this part because the last questions would be hardest questions. At least in my exam, it was like that. And there were so many cases with numerous questions there. So I was surprised at the end of my exam, but I tried to manage the timing. Then again, you will have 10 minutes break, which is optional. You can skip it. And the last part of the exam, data research interpretation and evidence-based dentistry, which is 45 minutes, which is enough for this part. And then you will have 5-minute post-test survey, which is normal in this exam like this. For the ADAT references, there are a bunch of references that they have introduced in their website. If you check the ADAT guide, there are numerous books and references, which is confusing. I want to tell you that one thing which is difficult about ADAT exam is there is not any definite source that you can seek for that. It's not like IMBDE exam, which is another exam be taken in the United States, and I will talk about that in the next session. So I remember that the time that I was taking my exam, I had the same problem. So at the end, I will tell you that how we will go to help you get through this problem. There is an ADAT practice test in ADA website. You can check it out, but I want to tell you it's just 100 questions. They have not updated its questions for a while, and they do not intend to do that. So it's just give you a full a general view of the exam. It's just for that, and you cannot get more from that, but again, it's useful. Go through it and check it out. About the scoring system of the exam, I want to tell you that IMBD exam, which is another exam in the United States, is just based on pass and fail. But ADAT score is not a pass and fail exam. You will have a score which is ranged between 200 and 800. And based on what they said in their website, the target score would be 500 and above. You may be surprised, but this exam is a really tricky exam with an extensive amount of material and topics with just 200 questions. And it's really hard to cover everything, be ready for everything for this exam. That's why they have targeted 500 for a good score. And I want to tell you that when they release your score, you will have a chart for each part of your exam. For example, biomedical science, clinical science, and data research, and an overall score. For each of them, you will have a score between 200 and 800. And then they will give you some graphs that shows you where you are standing among other participants in the exam. This is the graph that they provide me when they release my score. As you can see here, it shows the distribution of score of students between 200 and 800. And as you can see, the majority of students are standing here, just here, almost 500. Whenever you reach to 600, you are doing well. It means you are making a difference between you and other participants. If you can get this score, you are a genius. Again, this graph is the same graph, but it's a kind of average between 2017 and 2021. You can see the distribution of score of students. Again, the main scores are located here in this part. And as you approach toward the 800, it goes down. So one important thing about the exam is how to apply for ADAT exam. There are two types of applicants for ADAT exam. Basically, ADAT is taken by the dental students in the United States or Canada. So their way to apply for this exam is really straightforward. There are some forms and they can just go to their dean and they get confirmation from their dean and participate in the exam. But for majority of us, we are dentists or dental or students from dental students which are non-accredited dental schools in the United States and Canada. So there are some steps for us to go for applying for this exam, and I want to go through them completely to inform you about the process. For non-accredited dental school applicants, there are some items, some terms that you should know about them. First of all, it's Dent Pin, and then about ECE. Dent Pin is a dental personal identifier number for the US dental educational system and standardized testing programs. You can go through ADA website, which the address is here, and ask for your Dent Pin. Dent Pin is an 8-digit number that when you want to take any dental exam in the United States, you should get this number. And all the dental exams you take in the United States, will be connected to this number. It's a kind of welcoming to the dental education of the United States. And you can go through this website and just search for Dent Pin. It's really straightforward, and you can do it very easily. After you got your Dent Pin, you should go forward to the next step. The next step would be submitting your dental educational documents to the ECE. ECE is Educational Credential Evaluators. It's an organization which is located in Milwaukee, USA. Here is the website address. After you got your Dent Pin, you can go through their website and ask them. There is a form, you should fill it out, and you can request for transforming your dental education documents into US equivalent type, which is a GPA between 0 to 4, and your scores in your different topics that you have taken in your dental school returns into ABC. So you have to send your original documents or notarized one by mail to their address, and then ask them to connect this report to your Dent Pin and send it electronically to the ADA. After ECE report has been sent to ADA, you will receive an email from ADA that shows that you have the eligibility to take the ADAT exam for 30 days. But don't be worried about that, because you can extend these 30 days by paying a few amount of money. Next step would be scheduling your exam. After you receive the confirmation for eligibility to taking ADAT exam, they will provide you a reference number. With this reference number, you should go through this website, Pearson VUE Center. Pearson VUE centers are centers in United States and Canada to develop and deliver certification or licensure exams. It's a kind of like Prometrics for IMBD exam. There are many centers, even in Toronto, which I took my ADAT exam there. So you can go through their website and schedule your time. The good point about the exam in the United States is that it's in your hand. You can reschedule your exam even 24 hours before your exam. But you should check their refund policies. But again, you can change based on your plan. So it's a good point about the US dental exams. About the ADAT timeline, ADAT exam is held in each year for a period of 6 months, each year from March 1st to August 31st. So you will have time to take your exam between these two dates. For the exam attempts, as I told you, it's not a pass and fail exam. So if you are not satisfied for your first score, you can go ahead for the second attempt or more attempts. For the second attempt, you can reschedule. You can go again for applying a new exam with ADA, and you can take your exam within 45 days after your first attempt. But if you want to go for more attempts, you will have just one chance in each cycle, which means in each period of 6 months in each year, you will have just one more chance to participate in the exam. And there are some conditions. It's not that much hard. Don't worry about that. In the United States comparison to the Canada, it's really more straightforward, and there is nothing to be worried about that. But I want to tell you, if you go, for example, for the second attempt, any university you apply for that, the first and second attempt scores will be sent to your university. As I told you, Dent Pin is a number that all the exams that you are taking in the United States will be connected to that PIN number, and you cannot change it, and it would be forever. So be aware about that. Here you can see the examination fees. As you can see, there is a $390 US dollars for ADAT fee. And for the candidates of non-accredited dental schools, there is an extra fee of $235, which the total would be, I think, $60.25, which is fine in comparison with Canadian exams. This is for 2021. Maybe they are gonna change for this year. I'm not sure about that. You should check it. Here's a small summary about what I told you before. ADAT exam is accepted with over 400 programs in the United States and Canada. It's offered at Pearson VUE test centers in the United States and Canada. The test time is 4 hours and 30 minutes. And the availability period of the exam is from March 1st of each year to August 31st. And the topics include biomedical science, clinical science, and data research interpretation. I want to go again through the application process for non-accredited dental school students or dentists to make it more obvious for you. As I told you, the first step would be obtaining Dent Pin from ADA website. After getting this number, you can go submit your documents to ECE with this number, and then ECE will transform your dental educational documents into the US equivalents, and they will send it electronically to ADA. Then you will have an confirmation email from ADA and eligibility period to schedule your exam. Then you will go scheduling your ADAT exam in Pearson VUE website. So that was a general information about ADAT. I just tried to make it easy for you because I know there are a lot of confusion about this exam. And since this is new for the dental students here in Canada, so there would be more questions. I will cover them after I finish my slides here. But before that, I want to tell you that I've been working hard since last month with Confidentist Group to prepare a comprehensive course about ADAT preparation for people who are seeking for this exam. So I've been in contact with many top dental school students in the United States, and I have gathered their recommendations about the materials and the topics that should be covered for this exam. I myself have been engaged through all of the US dental exams. Just recently, I want to tell you that I've passed NBDE Part 1 and Part 2 in my first attempt, and in my ADAT score, I was among the top percent students or scores in the ADAT exam. I've also reviewed all the questions of the ASDA released questions several times, and I've studied them from the oldest one to the newest one, so it can help me to just know about how they have been changing the questions. So I'm kind of confident about the questions. I'm totally aware of the questions, and based on what I know about the questions and the recommendations from top students from the US dental schools, I'm providing some comfy notes. In preparing these comfy notes, I've been mentioning two main points. First of all, as you know, ADAT is an extensive exam. It has so many topics to be covered. So I've been trying to include all the topics based on ADAT's guide, which is provided by ADA website, and our comfy notes would be the same topics as you can see in the ADAT guide. The second point that I considered when I was just gathering everything and preparing the Confi notes was trying not to overwhelm students, because there are lots of topics that should be covered in this exam, and this exam doesn't dig in that much. As long as you know the general information about everything, you will be fine, and consider that you are not going to get, for example, 700 out of 800. If you can go for that, good for you. You can go and you're a genius. But honestly, it takes a lot of time if you want to go for that, but it's doable. I don't want to scare you off this exam, but I want to tell you that you should be prepared of, and we are here to help you. Just check the Confidentist website. I think the information will come out at the end of January, and my goal is just to launch this course by the end of the February. We are working so hard on this, and it will be included on comprehensive lectures, Confi notes, sample questions, question and answer sessions, and most importantly, we are trying to manage 2 mock exams, which is really unique because you cannot find something like this anywhere. And I think it can be really helpful for you. We are trying so hard to prepare these 2 mock exams based on information that I have and I'm gathering from the dental schools in the United States. So at the end, thank you for listening to me, and I hope that information that I've provided to you would be useful for you. Now I stop sharing and I'm here with you. You can ask your questions. Just please use the raise hand in your Zoom meeting, and I will choose you one by one and try ask all of your questions. Thank you. First of all, we start with Sadia.
Hi, how are you?
I'm fine. How are you?
Good. So I've applied for ADAT and my exam is end of April. So I'm just, yes, so I did a AFK course with the Confidentials, but I'm not giving AFK because my aim is to get into UFT and the application closes 1st July. So I have to give the exam before that. So just regarding your course, if you're starting in February, like how long is your course, and is it a comprehensive course or AFK course? Is kind of like I'm not sure what the course is involved. Like I should wait for it. What should I do?
Yeah, as I told you, we are preparing everything. I have general information for now. We have not just finalized everything, but I can tell you it would be a comprehensive course, which is split in different parts. You can take different parts of the course. It consists of 3 parts for 3 parts of the exam, and you will have 2 mock exams. You can just get them separately or all together. It depends on you. But based on my assumption, I think it would take at least 3 months.
So 3 months means April, right? End of April.
We are going to, I'm not sure about that. You should just talk with Confidentist group, but my goal is the end of February. So start of March.
Right. Okay. Because the whole goal is to get into UFT and give the exam before the application deadline.
Yeah. For your information, I forgot to talk about this part. As you know, University of Toronto and McGill University has requested ADAT instead of AFK for the new cycle. And I think that all the universities in Canada will go the same way. So you should be prepared for ADAT exam for future applying to the Canadian schools. And I will tell you in the next session, when I'm talking about the US dental schools, it's better for you to take ADAT as well as IMBDE. So I leave this part to the next session, but I forgot just to tell you about this part. Yeah. So your question is done. Now we have Chaganti.
Hello, Doc. How are you?
I'm fine. How are you?
I'm good, thank you. So I just want to know if you can suggest me any resources for the stats and for the basic basic group, like for biochem, especially biochemistry and physiology. What are the resources which we can at least refer? I do understand that you said we don't have any standard books like for INDB, but
Yeah, exactly.
if you can give me any kind of resources or any books, anything which we will have to refer to prepare for those two sections, please, it would be really helpful.
There are lots of stuff. You can find them through the net, but you know, it's really confusing. What I'm doing here is based what I know about the questions. So I'm trying just to gather information from different sources that you have access right now to them. I'm just, my job is just trying to manage them in a good way based on ADAT guide, and just make them simple as much possible. But you know, if I want to tell you, you can go through the material for IMBDE, but you know, that would be too much. And the focus on in IMBDE exam and ADAT exam is totally different. So you should have a different approach for each of these exams.
So how different would it be between both?
The difference?
Yes.
In ADAT, you have to know more about the part one, because you know, if you check the items, it says everything that you should know, but you shouldn't dig in that much in ADAT. In the United States, before IMBDE launches, I think it was in 2021, they officially started to replace this exam with the late exam, the exam that they took before. Before that, it was just part one and part two. Part one was totally like part one of ADAT, and part two was like clinical part of ADAT. But now IMBDE is just more focused on, they call it domain of dentistry. So the amount that they pay attention to the part one is really less than ADAT. For ADAT, it's more comprehensive. So you have to know more about the part one.
Okay. And sorry, the last question. Do you do you know for how long would the ADAT score be there for? Like for INDB, it's the score is whether it is pass or fail, it's going to be there for valid for about 5 years. So any idea about how long would the ADAT score be valid for?
Basically, actually, I have not any idea about this, and they have not mentioned anything about that.
Yeah.
But I think that would be the same. So you don't need it after that.
Okay. All right. Yeah. No, given the case, it's very tough, and like people give attempts, and there's a lot of competition for while applying to the universities. So I just wanted to know if I have to keep giving the exam every year, if one cycle is being lost, and if we have to give it another cycle.
Yeah.
Okay.
Yeah.
Thank you so much, doctor.
No worries.
How long does it take? How long will we?
So I can see that there's not any more questions. So it was my pleasure being with you today, guys. And I wish luck for you. Just keep following Confidentist website. They will inform you about the recent changes and the last information. I think they said that it would be at the end of the January, maybe, but check them regularly. So I can see a question here, Parchita.
Yes, doctor, I just had a question. How different is the approach to the ADAT as compared to the AFK? I just wanted to know, how is this exam different from the AFK by the NDEB?
I want to tell you that if I want to compare these two exams, you should say ADAT is AFK plus Biomedical Science plus data research. So it's more comprehensive. You know, it's a kind of specialty exam. And the day one that I came to Confidentist, because I didn't know that they have included ADAT for advanced placement in Toronto and McGill. And I was just wondering why they have put this exam for advanced placement, because that's too much. It's just for getting some specialty programs in the United States. But it is what it is. So you have to be prepared for this exam.
Okay.
And if you study wise, you can get through it.
Thank you so much, Doctor.
No worries. So Ahmed?
How long does it take? How long does it take being ready for?
For what? What do you mean? Hello? I don't know who is talking. Ahmed? So since Ahmed doesn't answer, we will move to Kasra.
Good morning, doctor. Sorry I joined late. What is considered a good score in ADAT?
As I told you before, based on what they have mentioned, if you get 500 and above 500, you will be fine. But I will recommend you go for more than 500. 500 is just a standard, because if you are gonna go for University of Toronto and McGill, and you know there is a very high competition in Canada, so just try to do your best. If it was USA, that was fine, but for the Canada, I have not an idea about that.
All right, thank you.
Yeah. So Ahmed? Ahmed, I can't hear you. I want to ask about the fees. I told you before about the fees in my demonstration. The total for non-accredited dental students or dentists would be, I think the total would be $625 US, but it is about, it is for 2021. They may change it this year, but
to be ready for exam? How long does it take in confidence group if we want to?
You mean you are asking about the length of the course?
How long does it take? How long does it take to be ready for them?
For the exam, it depends on you. It depends on you. But if you want to go for a high score, I will recommend you maybe 5 or 6 months. But for a standard score, it's up to you. I cannot give you a time. I myself, I passed my MBDE part 1, part 2, and my ADAT within 8 months altogether. But it depends on you. I cannot suggest you anything. You should just start it over and just check it out, how it goes with you. It depends on how many hours you are going to study and other stuff. So I cannot just tell you an exact time for preparing for this exam. But our course would be, I think, 3 months, based on what I know for now.
Doctor, if you don't mind, I just have another quick question. I'm Rachita speaking. So I just wanted to ask, besides your course, what other material we would have to read? Like if we are just, dedicatedly just taking the course at Confidentist. So the course material and plus what do we have to put in to get a score of around 600 in this exam? What other resources?
You will see the material. So when you see the material, you will not ask me.
Okay.
Because that's enough.
Okay, that's going to be enough, like what we are.
Yeah,
Thank
that
you.
would be enough. That's too much.
Okay. Okay.
Yeah. So, Sadia, do you have any question?
Yes. You said that you can give the second attempt 45 days from the first attempt, not when the result is declared, right?
Yeah.
But
no, it's a distance between the taking up 2 exams.
Like the day you give the exam, not the result.
No, not the results.
Okay.
It's about the exams.
Okay, and the result is usually declared like 2 weeks or
3 or 4 weeks. They have mentioned 3 or 4 weeks, but they released it really earlier.
Okay.
Maybe 2 weeks or maximum 3 weeks.
Okay.
Do not compare USA with Canada. It's total.
Right. Like
totally
the whole
different.
aim is for me, the whole aim is the UFT thing. So I'm kind of, because your course is overlapping all the dates now. Like I'm just thinking how to go about it.
Yeah, I know. Yeah. So let us just start the course, and you can just figure out what works better for you.
Right.
I'm not sure about the date of the mocks, but for sure it would be at the end of our course.
Right.
I can't tell you right now anything. Maybe there would be options for students like you to take mock exams earlier. I don't know. Right. So let's just wait for that. Just keep following Confidentist Group website, and they will inform you about everything.
Okay, and one more thing. It's a percentile exam, right? It's your score is compared with the people that's given the exam.
Exactly.
So the score is compared on the day of the exam that I've given and other people that have given on the same date, or the previous one and the one they're going to give, and something like how is it percentile? Like
I'm not actually a statistical man like that, but my assumption is they will check your score with the same cycle. You know, in each year you will have a 6-month period for the cycle.
Yeah.
So they're gonna check you with other students on that cycle, and at the same time they will check with you, with other students in your own exam, because in each exam it's not like that they just count the number of questions you have answered. Any question have its own value. There are hard questions and simple questions, and there are some questions that are not scored in this exam.
Right. Because when you apply for the universities in Canada, the cycle has not finished. So I'm assuming it will be the score the day of that, how many people have given it, something like that.
Maybe. But for sure, they will check your score with the people that have taken at the same date with you first.
Right. Yeah. Okay. Okay. Thank you.
No worries. So, Mohammed.
Hello, doctor.
Hi. How are you?
Thanks for your useful. I just had a question. I want to see if I interpreted it right or not. As a dental dentist, if we take ADAT exam and get a, for example, good score, and we can finally
I can't hear you very well.
To a US audience. How is it now?
Excuse me, can you repeat your question? I didn't hear very well.
How is it now? Is my sound clear?
Yeah, now it's fine.
Yes. The question, I want to see if I interpreted right or not. If we take ADAT exam and we can get, for example, good score, and we finally get admitted at dental school, after, for example, for oral and maxillofacial surgery or orthodontics specialty, after completion, can we practice in the United States, or as we are international dentists, again, we should, for some exams or do some procedures to validate our previous dental degree.
So I didn't get your question exactly. Do you mean if you go for US dentals or you go for Canadian dental schools?
a US dental. If, for example, we take ADAT exam and we get admitted to a dental school, and for example, we finish oral and maxillofacial surgery.
Sorry about that.
And we practicing.
Your sound is disconnected, so I can't hear you very well. Sorry, but I will back you to Muhammad. Let me answer all the other questions. I will come back to you, okay? Just try to move somewhere, maybe your connection would be better. Sorry about that. So, Chaganti?
Hello, doctor. Sorry, just another question.
Yeah.
Yeah, so I just want to know what do you mean by this data research? Like, what type of questions can we expect in this data research?
You can go through ADAT guide. They have explained there about the items as I showed you here before in my slides. But I know it was like in my exam the same. It's a little ambiguous, and you cannot find a good reference for that. What I'm doing right now is just talking with the students in the dental schools in the United States and try to get help from them to just cover all the concepts that they need to know about this exam.
Okay. Thank you.
Yeah.
Thank you so much.
So, Adel?
Hello, Dr. How are you? Thank you so
I'm
much
fine.
for your detailed explanation and everything about the exam. My question is not for me, is for my son. He's in a biomedical program in Western University, and he wants to start preparing for the exam from now. So my question is, this exam that you like described or explained is the same one or different format? In different format for undergrad and for us and for in medical dental schools.
There is just one type of ADAT exam. There's not.
It's just one type, yeah.
Just one type, yeah. There is just one ADAT exam.
Oh, yeah. So yeah, I know. I knew now that everything, because most of the he is studying now. Most of them biomedical science, biochemistry, physiology, histology, everything. But for the dentistry part, like he will like be you. It will be useful for him to join confidence for this course to prepare him well. Yeah. Thank you so much, Doctor.
No worries. So Halima.
What will be the fees of the course you people will be launching?
Pardon me, can you repeat your question?
The course fees, the preparatory course fees.
It's not yet finalized. You should talk with confidence,
Okay.
about the
Okay,
financial terms. Yeah, I have not any information about that. Sorry about
okay.
that. Just wait for that. I think they will inform you by the end of the January.
And the course will start by the beginning of March. That's what you're saying, right?
Yeah, I'm trying so hard to do that because, because I'm moving to the United States after that. So I'm just trying to manage everything before that. So if it's me, I want to just launch it tomorrow, but everything should be ready for that.
Okay, thank you.
Yeah, no worries. So Pankhodi. Sorry if I mispronounce here. It's Pankhodi.
Hello, doctor. I wanted to ask that if we have been out of touch with the academics since the last 4 to 5 years, and now we want to prepare for this exam, how many hours per day would you suggest for somebody who hasn't been into academics since the last 4 to 5 years? How many hours per day for maybe say 4 to 5 months? A rough estimate.
It's a personal question, so I cannot answer with a definite answer. It depends on you. I don't know how much information you have already know or you can remember. or when you want to go take your exam. So I cannot tell you something, but I think you will need at least 6 months, at least, if you try hard, because there are lots of topics that you have to cover them.
Okay. Thank you, doctor.
No worries. So, Mohammed?
Hello, doctor, is my sound clear? Hello,
Hopefully.
doctor, is my sound clear?
Hopefully.
Thanks. Thanks for your useful information. I had a question. If we take ADAT exam and we, for example, get a good score and we finally get admitted to a UL school, for example, oral and maxillofacial surgery. After we complete our course, after, for example, we complete 5 years oral and maxillofacial surgery, can we practice in US, or as we are international dentists, we should again validate our previous degree and something like INBDE and likes.
So you're asking about getting acceptance in a specialty program in the United States?
Yes.
So it's a total different story. It's a total different story. But if you get specialty there are some regulations. As an international dentist, you are permitted to work in, I think, 10 states of the United States, like Maryland, Washington. And after that, the good point is after 3 years of practice, at least you can move to California. As a specialist, I'm talking about.
So we don't need to take any further exam for validating our previous dental degree as an international dentist.
Yeah, you will need. Even if you go through the advanced placement like me in the United States, at the end, when you want to go for your licensing for any state that you're gonna start your work, like other dental students, you have to take an exam. It's not that much. Just don't compare it with the Canadian exams. It's not like that. It's straightforward and you can do it.
I got it. So many thanks for your response.
Yeah, no worries. So
so many thanks.
Pankori. So Nilufar.
Hello, doctor. Thank you for all the information about ADAT.
No worries.
And I've recently come to Canada and I'm wishing to give my ADAT and get into UFT. So I wanted to ask, if I don't get into UFT or McGill, if I give the ADAT, what are the other options to enter to US schools? Can I directly get admission for specialty program being a dentist from India?
Yeah, as I told you, I will have another session in the next week, and I will totally explain about this stuff, about the United States. And if it's me, by my experience, if I was in your position, I would give it a try to go for the US dental schools, because it's more straightforward. You will have more chances. And if you take your ADAT for advanced placement, it can boost your chance really high. And even though if you want to go for the specialty programs, I would recommend that take ADAT. So ADAT is really useful for you.
Okay, to directly enter into the specialty program in the US.
Yeah, you can. Yeah.
Okay.
Yeah, you can.
Thank you. Thank you.
But I will recommend that take a IMBD exam as well.
Okay.
Yeah.
Thank you, doctor.
No worries. So Sadia, you have a question again?
No, it's okay.
Okay.
I didn't put my hand up, but now that you've come back to me, I missed it. You said to go to specialty program in US, you don't have to give INDB, just ADAT is enough. You will need
many
INDB.
of the programs says that, for example, for prosthodontics, if you check the website, it's a total different story. Let me talk about that in the next session. But for your information, applying to the specialty programs in the United States is different. It's a different way that you are going for advanced placement. There are two different websites that you have to go through them to register for your application there. And for the United States specialty programs, many programs like prosthodontics and periodontics, they said that they do not need ADAT. But if you have ADAT, so it can make a difference for you for sure, you know. But for IMBDE, many of them say you don't need it again. But it is the best way that you can prove them that you are ready for them. You know, you should do whatever you can do to show them that you are encouraged to get the position. So, Nishant, Sima, please, would you please mute your audio?
Hello, doctor. Can you hear me?
Yeah, Nishant, I'm with you.
So when is the course start? I just joined late. So can you tell me when is the course starting and like which date is the course starting and how long will be the course for the ADAT?
You're asking about the length of the course?
Yeah.
My assumption is it would be at least 3 months.
Okay.
Yeah, but you know, it's not finalized yet, so I don't want to just mislead you. Just wait for Confidential Group website to just came out the information from there.
Okay. And so for Canadian universities, do you have an idea how much ADAT score will be requiring approximately? Like for US, it is approximately 500. So for Canadian, how much do you think will be eligible to get a call?
I didn't get your question. Can you repeat it again?
Yeah, sure. So in Canadian school, how much ADAT score will be required to get an invitation from the Canadian school? Like
I don't know. Nobody knows. Nobody knows. But you know, in Canada, competition is really higher than the US. So if it's US, they said that above 500, you will be fine. But for Canadian, I'm not sure about that. I can't give you a definite answer about that. You should try to do your best.
And
I recommend you just follow me in the next session, which I want to talk about the United States programs, and maybe you will change your mind to switch toward the US instead of Canada.
Yeah, sure. And so Michigan accepts the ADAT, right? IMBD plus ADAT.
For advanced plan, there are a few programs like that you have mentioned. Yeah, they accept ADAT and it can boost your application actually.
Okay, perfect.
Yeah,
okay.
for sure.
Thank
Even for other universities, if you check their website in Capit, they said that they don't need ADAT, but if you have ADAT, they will consider it. So it can make a huge difference for you. So go for it.
Okay, sure. Okay.
Yeah.
Thank you, doctor.
Yeah, no worries. So I think we have covered all the questions. So best of luck to all of you. Thank you again for participating in this session. And I hope that see you all in the next session, because I have so many things to tell you in the next session. So have a great day and goodbye, everybody.